Hey everybody, Jetty Azuma here with Movement University and our first installment of our weekly question and answer session. Today we're going to answer a question from Kelly here in Ojai, and Kelly's question was around how to heal sciatic pain from chronic overuse as a hiker. We know we've got a lot of beautiful hiking here in Ojai, California, and she's been having some trouble with that. So the first thing I want to do is I want to make a distinction between sciatic pain, true sciatic pain, and something that might be different than sciatic pain, because nowadays anything that causes pain or discomfort or symptoms here down the leg, we're treating as sciatic pain. True sciatica or true sciatic pain is related to some sort of impingement or inflammation around the sciatic nerve that comes down through the backside off of the sacral area and down the back of the leg all the way into the foot. So someone with true sciatica might report feeling numbness down the leg, a pain in a very specific defined line down the back of the thigh into the foot, tingling in the lower extremity. And that might be something that can be treated with some really simple stretches, mobilizations with a tennis ball and a foam roller, and then retraining the muscles to move more efficiently. Other things that may not be sciatica are in the realm of just butt pain, maybe some of that same kind of achiness or tingling, but just in this general area. Something else that might be shooting down the front of the leg that we wouldn't call sciatica, or some of these other conditions that just relate to leg pain. Nowadays, anytime you have pain back here that goes down the leg, we're calling it sciatica. So that's the first thing, and I recommend that you consult with a physical therapist or another trained professional to help you determine what you're actually treating. But for the sake of this question and answer, let's assume that there is some sort of sciatica, true sciatica happening. So the first thing you want to do is you want to try and free up whatever's causing the restriction in that area. Oftentimes it's a tightness in a muscle or a tension in the nerve, in the neural tissue, because you haven't been moving well back there. And if it's something that is getting irritated when you hike, then that motion of putting one foot forward, loading into it, and stepping up can be causing pain in that area, especially if you're not using it properly. So a couple of really high-tech tools that I want to introduce to you. The first is a tennis ball. And this is no special tennis ball. I think they're $3 for one of those containers of 3. And this can become your best friend and your personal massage therapist. I tell anyone who has any sort of muscle pain or something that you would normally ask somebody to massage or work on for you, to use a tennis ball, especially because it's very low risk. It's very unlikely that you're going to actually hurt yourself by rolling around on a tennis ball, and they're ubiquitous, very easy to get. So for example, if we're talking about true sciatica, right in this region between the butt bone and the side of the hip bone is where the sciatic nerve passes right through. So you can draw a line down the pelvis in between, right in the middle of your sit bone and your hip bone on the side. And there's some nice layers of muscle tissue and connective tissue back there that can be causing discomfort. So you take a tennis ball, you get it right in that spot. Sometimes I'll have people put the tennis ball up against a wall to roll on it, or you might sit on it on a surface. You can't see me here, but sit and just roll into it. My favorite is to get down on the floor, putting the ball down on the ground, and just finding some sticky spots in there that really help, that really need to go, that really need to be released. And you can tighten up on the ball and then release, tighten your muscle that's right on top of the ball and then release it and try to roll around on it. And that might give you some immediate relief, and it might give you long-term loosening of those tight muscles. Another high-tech instrument here is a foam roller. These are pretty readily available these days. I think they run from anywhere from $20 to $30. Again, this is something that you can put on the ground and roll on, or if it's too tender, put it against a wall or a surface that you can roll into. It doesn't just have to be limited to that spot where I was saying the sciatic nerve passes through. It can be the entire thigh. If there's an area where those muscles feel tight and stiff and restricted, and it feels a little bit sore or a little bit achy when you roll on it, chances are it's a place that you're missing some mobility in your tissues. So that's one way to treat it. Let's talk about after it's loosened up and it's feeling like it's got some blood flowing through there. We're all about retraining. We're all about efficiency. So if you're not moving well in the first place, if you're having a problem the way that you hike, if your knee goes in and when you step up you're in a bad posture here because you got a backpack on and you're trying to hold it, then you're not going to really be using the muscles that you're supposed to, thus creating something like an overuse or a chronic injury that recurs. So we have to change the pattern with how you step up. And we've got a lot of great videos with some specific exercises that I'll post in the comments section of this video. But generally speaking, whenever you're stepping up, for this example I'm going to show you on a step, but it would be the same as if you're hiking uphill. You want to start with your foot pointed in the direction that you're heading. Okay, so let's say I'm stepping up onto my right foot. My right foot's going to be pointing straight ahead. I'm going to have my knee either right on top of my ankle or a little bit out to the side, because most people, the breakdown happens where their knee drops in. Or on top of that, their foot, instead of being straight ahead, is rotated out to the side. And then we get this kind of twisted knee position that looks like this when people hike up. Now that's happening because you're not using your muscles properly. So what do you do instead? You practice keeping the knee in that position, rotating the hips, the pelvis a little bit towards the leg that you're loading this way. So since my right leg is here, I'm rotating my left hip towards my right leg, and then as I go up, I'm leaning into the hill or into the mountain that I'm climbing, and I'm going to drive through the center of my foot, okay, so that I'm engaging my glute. Let me show you from the side. So you can see that my knee is right over my foot here. You're going to have to take my word for it because you can't see my foot. And I'm a little bit rotated out to the side. And as I drive up, I'm not letting my knee go way forward either, because if I do that, a lot of pressure on the knee and I'm not going to use my hip. I'm going to lean forward and drive up from here. Now there's a lot of videos that explain in more detail how to get proper hip mechanics, and if you have questions about that, feel free to message us on Facebook. This just gives you a general idea of how to take a different look at how you're hiking or going up a staircase, anything that's uphill or up an incline. There's certain considerations you want to take into effect that are going to make you optimize your movement, be more efficient, and decrease the likelihood that you're going to keep irritating those familiar trouble spots. So try that out. If you have questions, we're available. Reach out to us. And thanks for your question, Kelly. I'm sure that there's many other people out there with the same kind of issue. I know I've had this happen to me in the past. So keep the questions coming, guys. Any new questions you have, you can post in the comments here. You can message us directly, and we'll be doing another installment of our question and answer next week. Have a great weekend, and be safe on the mountain.